Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, answering those questions and connecting you to resources. A recently published study titled The Economic Burden of Multiple Sclerosis in the United States shows the average total cost of living with multiple sclerosis is $88,487. That's annual cost per year. And the annual economic burden, the cost to all society, including individuals who are living with MS, the government, employers, health insurers, and more, well, that number comes out to $85.4 billion. That's billion with a B. This study was commissioned by the National MS Society, and it highlights what anyone affected by this chronic disease already knows. Living with MS is expensive. Joining us today to share some strategies and resources to help you understand how to best manage the high cost of MS in your household is the Director of Benefits, Employment, and Insurance at the National MS Society, Sherry Perry. Welcome, Sherry, and thanks for joining us today.
Thank you, John. My camera is not coming up. Give me just a minute here. There we go. Thank you.
Good to see you.
Too.
The financial cost of living with MS is staggering. And we know that there are many individuals and families who really struggle financially after being diagnosed with MS. Can you tell us some specifics, what kinds of costs actually make up these astronomical numbers in this study?
Absolutely. So some of these costs come from a combination of non-medical, indirect medical cost, and direct medical cost. And some of those direct medical costs include things like doctor visits, co-pays, just out-of-pocket cost, prescription coverage, things like that, what the insurers pay. And some of the indirect costs are things like lost productivity at work, missing work, early retirement. And then there's some of the non-medical costs that include things like paying for caregivers, home and vehicle modifications, accessibility modifications, and things that insurers don't cover.
Well, $85.4 billion is a big, I'd say almost incomprehensible number for most of us. I'm hoping we can break it down and talk about some things that people can do to manage their costs of living with MS. So maybe we can start with employment. Now, the study showed that 21 billion of that $85 billion is attributed to those indirect costs that you mentioned that include missed work and early retirement. Well, as people explore how they might continue working, what should they be thinking about before deciding that they're going to leave the workforce?
That's a really good question. It's so important for people to know their rights and protections. It's also important for people to think proactively about their employment situation. It's really never too early to begin thinking about the future and what the rights and protections that you have available, as well as the benefits. Some laws that are in place include the Americans with Disabilities Act that talks about the relationship between disclosure and accommodations. Family Medical Leave Act is job protection. And then knowing your benefits through work, such as short-term disability, long-term disability, those can give you the time to kind of figure out and adjust to new treatments. Life insurance, health insurance, those are also benefits of work. And also considering federal programs that are available for support, such as Social Security, disability. It's really important to exhaust all of those options before leaving the workplace and work for as long as a person wants to and is able to. It's also a good idea to begin considering whether there are accommodations that can assist you in reducing the impact of some of those MS-related symptoms. The Americans with Disabilities Act very simply and generally allows employees who work for an employer with 15 or more employees who have disclosed to ask for a reasonable accommodation in order to do those essential job functions. A reasonable accommodation means tools or equipment that can help you meet your job performance expectations and duties. It's really accommodations or modifications to a work environment or to the way essential job functions are performed. And someone also may consider reducing their hours either with or without accommodations or changing careers in order to stay in the workforce longer.
I'm glad you brought up that whole concept of reasonable accommodation. It's something that a lot of people tend to overlook, and it is something that each of us have a right to. Maybe you can give us some examples of reasonable accommodations that someone with MS might request.
Absolutely. There are a lot of creative ways to accommodate individuals with MS and some of those more complex symptoms that they may be experiencing. Working from home, flexible schedule, longer breaks for someone who may be experiencing fatigue-related symptoms, a desk closer to the restroom, specialized equipment. The need and type of accommodation may even change over time as symptoms change or when a person is experiencing a relapse or increase in symptoms. This is definitely not an exhaustive list, just some ideas to get people thinking. Of course, no two people or situations are the same. So we encourage individuals to talk to their doctors and utilize some resources that are available to help brainstorm some of those accommodation ideas that are going to meet their specific needs.
You know, you reminded me of a conversation I had with someone who one of their particular symptoms would say were very, very sensitive to heat. And the best accommodation they said they could ever ask for was a fan. It made all the difference in how they felt, especially later in the day. Mm-hmm. So you're right, it does vary person to person. We've actually heard from Crystal, and Crystal wants to know how to request a reasonable accommodation at work. Is the process the same for everyone, or can it vary?
It definitely can vary. And in order to request an accommodation, a person needs to disclose to their employer. So we would need to talk to Crystal, see if she's disclosed, and if she hasn't, make sure she understands the relationship between disclosure and accommodations. Employers only have to accommodate known disabilities. You also want to make sure she's familiar with the pros and cons of disclosure in her specific situation. It can certainly be a complicated process, and you just want to be careful and make sure that you're planning ahead. With that being said, if she has disclosed, she can then request an accommodation. And to start that process of requesting an accommodation, they simply need to let their employer know that they need an adjustment or change at work due to a medical condition. It doesn't have to be specific. It's okay to use that plain language. And you're really talking about what is going to help you, you think about the symptoms that you're having and what solutions may come up to help you perform those essential job functions. You don't need to mention the ADA, but requesting an accommodation is an interactive process. The bulk of the responsibility is on the employee to come up with those solutions and to have backup solutions. So there should be some back and forth, and sometimes this can include some negotiation. So it's very, again, specific to her individual situation.
The economic burden study also showed that $63.3 billion is attributed to the cost of direct medical costs, things like medications, doctor and hospital visits, and medical equipment. Health insurance is such a complex subject, but having the right insurance can be a key contributor to someone's financial security. What's important for people to understand about their insurance options? And are there any professionals out there that can help someone navigate all the choices that are available to them?
Yes. So definitely our healthcare system can be difficult to navigate, even when you're just part of that choosing a health insurance plan. Once you do choose a plan, you may still have limitations on what's covered. People are often underinsured, even though they have been paying for health insurance for most of their lives, either through employer or on their own or through Medicare. So it's really important to know what you're getting into and not just pick a plan based on cost alone. There's so much that you could risk. You could risk not having your prescriptions covered, your providers and network, and that's going to cost you more money out of pocket, or not understanding the type of plan that you're choosing. For example, a high deductible plan, someone may pick that because the cost per month is less, but because it's a high deductible plan, you end up paying all of your medical cost up front until you reach a certain amount, like $500 or $1,000, and that can be difficult. If you plan for it, you may be able to take care of that up front, but if you don't and you don't know what you're getting into, that can be very difficult to find resources for after the fact. There are resources to help people understand their options and what they're getting into. It does depend on the source of the insurance. So if someone has private insurance like employer plan or marketplace plans, they may have different resources. For example, people who have a marketplace plan or a plan from their state health insurance exchange, there are assisters available. You can talk to someone over the phone. Sometimes you can meet in person. There's still a lot of variance with COVID, but there's definitely help available for employer plans, talking to HR or even the customer service from the plan. Medicare has a program, state health insurance counselors that give help with Medicare. And of course, reaching out to MS Navigators, Benefits, Employment, and Health Insurance Support Team, utilizing the resources on our website. There's definitely a lot of resources out there. Some states have consumer assistance programs. MS Navigators can really help you find those resources as well as go over a lot of this information with you.
Once someone has the right plan, filing a claim to get coverage for things like medications or medical equipment, well, it can get complicated. Do you have any tips to share to make this process a little easier?
Yes, it definitely can get complicated. A lot of times people may have direct billing where the doctor's office are taking care of things like that, typically with prescriptions, excuse me, especially like the disease modifying therapies. There's a whole lot of paperwork and processes involved. So that's direct billing. But sometimes that's not available, or a lot of times with durable medical equipment, you may need to take the prescription that you get to that provider. Sometimes the doctors may send it, but vendors, the providers that are providing that equipment might be able to help you. They usually know how to get paid. They're dealing with the same insurance companies over and over. So a vendor may be a good place to start. But again, knowing your plan, knowing what's covered and what restrictions is also a good place to start. That way you're not trying to find something that's not available to you.
Linda wrote in with a question about filing an appeal with her insurance company because her health plan is making her take a different MS medication first before she can get the medication that her doctors recommended. Linda's wondering if she can file an appeal for this. So maybe you can guide us through what's involved in appealing this kind of decision.
Absolutely. So there are different processes depending on the source of insurance. If you have Medicare, the processes are very similar, but you definitely want to check with your plan to see what the specific process is. And you can appeal and should appeal anything that you think should be covered that isn't strictly written into your plan. That doesn't, as long as your plan doesn't say it's not covered, you should appeal that. Getting help from your doctor's office. Most of the time, your doctor needs to help with an appeal saying it's medically necessary. And you can check with the plan about the process. We have information on our website, general information, some general guidance and tips that can help as well. It sounds like Linda is experiencing step therapy or fail therapy, where they're asking her to try another disease modifying therapy first. And we know that medications, MS medications, don't work like that, and that can be very frustrating. So again, going back to the doctor, we have sample appeal letters for specific situations like covering medications and step therapy. So making sure you know the process for your specific plan, getting help from your doctor and the National MS Society MS Navigators, and utilizing all levels of appeals is very important. Sometimes there are 2 to 3 levels of appeals that you can go through to get that treatment or item covered.
The economic burden study showed that $1.1 billion is attributed to non-medical costs, things like caregiving or home or vehicle modification, as you mentioned earlier. Caregivers for people with MS spend about 24 hours a week providing care. Research shows that of these caregivers, 64% feel emotionally drained, 32% experience depression, and 22% have even lost a job due to their caregiving responsibilities. What are the important things for caregivers to know and understand when caring for a loved one with MS?
I think it's important for them to also take care of themselves, and going through this emotional toll can be difficult, and they are still impacted by these indirect costs. They may face early retirement, missed work, along with feeling emotionally drained. And unfortunately, there aren't a lot of protections, laws for caregivers. They don't have the disability, so that can be very difficult. There are some coverage. The FMLA, or Family Medical Leave Act, does allow for some time off work to care for family members, but that does lead to a loss of income. Looking to help with respite care, making sure that they are taking care of themselves and getting the breaks they need. That's involved in some of our advocacy efforts. And just finding support. There's support groups focused specifically for caregivers. There's community agencies. But just knowing this economic burden, these costs impact caregivers, the unpaid caregivers, just as I think if the percentage was about half of the cost for people affected by MS versus the caregivers. So these problems impact everyone.
Sherry, it occurs to me, since you're a part of the MS Society's MS Navigator team, can you tell us about the MS Navigator program and how navigators help people who are affected by MS?
Absolutely. So MS Navigators are a nationwide team of highly skilled, compassionate professionals who work with people affected by MS on a one-to-one basis. We act as supportive partners to find solutions to the challenges of MS, and that's going to vary from person to person. So part of our work is to do an assessment of someone's specific situation and see what their current needs are and how we can provide resources, the appropriate plan of action, and next steps to help people find those solutions that are out there.
Since we've been talking about the high cost associated with living with MS, can you give us an idea of the types of resources that an MS Navigator might share with someone who may be in need of financial guidance?
Sure. Like I said, the MS Navigator is going to assess their current needs. And so it could be helping someone to learn about their employment rights, learning about the ADA, learning about what protections they have, or how to use their benefits, make sure they're accessing those benefits that are available. It could be going over things to consider when picking a plan, helping them find programs to help pay for their medications, maybe a referral to a financial planner or tax advisor, and trying to find those specific solutions to the current needs that they're experiencing.
Well, how can someone contact an MS Navigator?
There are several ways. We have a lot of different channels: by phone through our toll-free number, which is 1-800-344-4867. You can reach us by email at contactus@nmss.org. That's also located on our website. You can reach out through some of our social media channels. We have an MS community on Facebook, and we also have online chat through our website as well.
The Economic Burden of Multiple Sclerosis in the United States study highlights the real impact of the cost of MS on the entire US economy, on people living with MS, their families, and their care partners. It really serves to underscore the urgent need for our policymakers and other stakeholders to help lower the cost of care and treatment for MS. This seems to be an issue that should mobilize everyone affected by MS. What can people at home do to help lower the cost of MS?
Besides some of the things we've talked about today, it's just really important to get involved. A lot of our advocacy efforts come from people sharing their stories, and they're focused on reducing the economic burden. We have some of our efforts include access to MS medications, access to healthcare, support for caregivers, home modification tax credits. These are just some examples. And there are different ways people can become involved. You can join our MS Activist Network, connecting with others on social media, contacting local officials, and sharing your story. And again, all of those have different levels. Some of it's you're just sending an email to your local officials. Some of it's more in person. So you can find out about this, how to connect through our website or connecting to an MS Navigator, and we can get that information to people.
I can only add, as somebody who is very involved in our advocacy work as an MS activist, it's easy to get involved, and it is one of the most empowering things that people can do for themselves to be part of the solution to some of the problems everyone faces. You know, you've shared some great insights and strategies for managing the high cost of living with MS. I'll ask you, what would you say are the top 3 takeaways that you'd like our viewers to remember?
Top 3 takeaways. I think when it comes to employment, be proactive. It's never too early to know what your rights are. Start planning, thinking about the future. Know your benefits. Enroll in benefits if you can. With health insurance, knowing your plan, knowing what you're getting into is so important. We know it's not perfect, but if you know what you're getting into, it will help you prepare a little bit for the future. And then my last takeaway would be reach out to an MS Navigator. You know, I went over a lot of information and resources today, and MS Navigators can help you find these resources, connect to these resources, and understand them as well.
Well, thanks so much for sharing your expertise with us. Sherry, we have time for a couple of more questions from our viewers. We heard from Charles. He wants to install a ramp to help him get in and out of the house in his wheelchair. Are there any tax credit or relief programs that can help with this type of a home modification?
There are. And so for tax credits, there are home modification tax credits in several states. So it would depend on the state that he lived in. Our website has a quick look of what is currently available in your state. If a state doesn't have a home modification tax credit, I would definitely reach out to local officials. Consider joining an MS Activist Network to help make that something that's available in your state. You could also consider speaking to a tax attorney. There may be other options available. Reaching out to an MS Navigator for help in finding other resources. There might be community programs, other programs that can help with that as well. Again, it varies a lot from state to state, but we can help kind of gather that information for your specific situation.
We heard from Macy, and Macy tells us that she has requested some accommodations at work, but her boss told her that they're too expensive. She wants to know whether there's anything she can do to fight this decision.
That's tough. So requesting an accommodation, it's an interactive process, kind of a negotiation. So the employee should come to the table with solutions and backup solutions, and try to work that out with the employer. Maybe there are other things. Unfortunately, employers not obligated to provide the exact accommodation a person requests, but does need to provide one that is effective. So for example, if there are 2 potential reasonable accommodation and one costs more, the employer may choose to provide the less expensive one as long as it's effective. So that means the accommodation doesn't need to remove the workplace barrier. The The employer also does not need to provide an accommodation that is an undue hardship to them. And that's going to vary from employer to employer what that would look like. But just keeping in mind, it's an interactive process, and try to having those backup plans can be helpful. And talking to an MS Navigator focused on benefits, employment, and health insurance can really help you brainstorm some of those accommodations and give you the resources that can help brainstorm those accommodations as well.
Well, I want to thank everyone who submitted questions, and thank you for being with us today, Sherry.
Thank you so much, Don. I enjoyed it.
Before we close, I want to remind you of something that I think we've heard more than a few times today, and that is that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the best information and resources on living with MS. And as Sherry mentioned, you can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please remember to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. You'll find ways to get involved, and you'll hear about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcast. I'd like to thank Sherry Perry for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. And I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Sherry Perry and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.